I'm Dr. Kat, a board-certified plastic surgeon, and I am honored that you chose me to be your plastic surgeon. As my patient, you have a responsibility to follow your pre- and post-operative instructions in order to ensure the best possible results. Plastic surgery is not a destination. It is a journey, and along this journey, there are steps that you must follow in order to ensure that it is exciting, enjoyable, safe, and an overall wonderful experience. So please watch this video carefully as I review your instructions. Now, myself and my medical assistant, Veronica, will review the pre- and post-operative instructions for your surgery.
Hi, I'm Veronica, Dr. Kat's medical assistant. I'm so excited for your upcoming surgery and to be a part of this journey along with you and Dr. Kat. I'm here to give you all the information and instructions you need in order to have a successful outcome.
So, Veronica, how do you think we can make people remember the instructions and follow them? Should we just send them the video like over and over again?
I just wish I could follow them around and make sure they follow all the instructions.
Well, I know that sometimes you just try to scare them and tell them this could happen, like your skin's gonna die.
I know, my scare tactics are kind of rough,
but I think
though.
then they have like nightmares. Like I've had patients tell me, oh my God, Veronica told me if I don't listen, then...
I'm just trying to warn them because I told them if they don't follow instructions, Dr. Kat will be upset.
Oh yeah, no wonder they come and they're like, don't be mad at me, but I accidentally blah, blah, blah.
I know, they have like this fear. No, but it's really important. That's why I do that.
No, it is important, and I think a lot of doctors don't emphasize proper post-op instructions, and then they have some outcome, something happens, and then it's too late. So in the end, I just want everyone to be able to follow instructions and have a good result, not mess up anything that I've worked so hard to do.
Exactly, I agree. As long as they follow their instructions, nothing should go wrong.
Maybe if we make the video more funny, then they'll remember it better.
I feel like we're pretty funny, right? People think we're funny.
Sometimes I'm funny. I don't know. Most of the time I'm pretty serious. Okay, so let's start with 2 months before surgery. Okay, so 2 months before surgery, Veronica, what's the most important thing?
To stop smoking.
Yes, and this includes, first of all nicotine products, so gum, electronic, anything with nicotine in it, and then also the other inhalants that they also ask about.
Don't smoke pot, yes, that counts. Nicotine gum, things like that. Hookah, don't go out to the bar, just please.
But yes, also this includes any inhalants because obviously while you're under anesthesia, you'll be on the anesthesia machine. So anything that affects your lungs will affect the way that you recover from surgery and also minimize complications. So please, no inhalants, no smoking, no nicotine of any kind. And nicotine can interfere with the blood flow to the skin, and that affects wound healing. So potentially your skin could die, fall off, your wound's not gonna close. So please, it is very important.
The last thing that you want is to have this beautiful fat grafting to your booty and then it's gone because you smoke.
I will literally cancel your surgery if you do not follow the nicotine instructions. So please do not smoke anything.
I've seen it happen.
Okay, so then also around this time, you're gonna need to have help after surgery. I know that some of you feel really heroic and you're super tough, but really you need to have some help. So call your friends, family, anyone after surgery that you think.
Anyone that will help you.
And also, you cannot drive after having anesthesia. You cannot throw yourself in a cab. You need to have a responsible adult for the first 24 hours.
Yeah, and Uber doesn't count either because you're gonna be by yourself. We need somebody who can drive you home, get you settled, make sure you take your medications so that you'll be recovering in peace.
And also, if you are having a more extensive surgery, you may need to stay in one of our plastic surgery aftercare facilities, so they will be able to help you. And if you want to stay for more days, just let us know. We'll help you arrange that.
I know, I want to stay there. Can I just go and stay there for a little? I have them pamper me, take me to the bathroom, give me my medication.
They'll wash your hair.
They do everything for you.
They'll do your drains.
You need to go there.
They'll get stuff for you. Now, 2 weeks before surgery, so this is where it really becomes important. You really need to pay attention. It is so important to stop all aspirin, Motrin, ibuprofen, Aleve, vitamins and herbals, alcohol, 2 weeks before and after surgery. Even my daughter knows this. She repeats it a ton of times because I say it so much.
Just cleanse yourself. Take the opportunity to make sure that your body is nice and clean for any additional substances, and do not take Advil. She will cancel your surgery because of Advil too. Yeah, no, even if you have a headache, take Tylenol. Don't take Advil.
Yes.
If you have cramps, take Tylenol, not Advil.
And if you have any questions about something, please ask. But in the end, you're just gonna be able to take Tylenol, and pretty much you're gonna have to stop everything else because all those other things could potentially make you bleed in surgery. And as you know, I hate any blood in my surgical field, and I want you to have a really, really great, easy recovery.
2 weeks before surgery, Please do not overexpose yourself to the sun or get a sunburn.
Yeah, you really do not want to have your skin peeling off in my surgery site. Please do not do that.
Save the bikini body for after the surgery.
Yes, then you can safely tan with sun protection, of course.
And you can show everyone how you look.
The week before surgery, please let us know if you have a cough, a fever, any illness, or if you have any sort of skin changes or infections. If you are feeling sick or have a cough, please do not take over-the-counter medication without asking us. You also want to start thinking about what you'll need going into surgery. Most importantly, pick up your medications. Don't wait till last minute.
I don't want to be running to the pharmacy during your surgery because the nurse tells me, oh, she doesn't have this, or oh, she doesn't have that. So please prepare ahead of time.
And when you go to the pharmacy, you can also pick up the special soap that we recommend, the Hibiclens. You should be able to find it in almost all pharmacies in the cleansing aisle with the alcohol and peroxide. It's a green bottle. It's really easy to find. And also the TED hose. So we recommend using TED hose that is above the knee because when you're recovering from surgery, you don't want to be constantly pulling them up. They have thigh-high ones, and they don't have to be overly tight.
No. Please don't get them too tight because then we can't get them off of you.
Yeah, so less than 20 millimeters of mercury, anything that feels comfortable because you're going to have to be in the TED hose for at least a week after your surgery. It helps with your circulation and prevents you from getting a blood clot.
So 2 days before surgery, we want you to cleanse your body with the soap that we told you about. And just make sure you wash it really good, keep it on for like 2 minutes, scrub in all the creases, in between the breasts, underneath.
And the belly button. The belly button.
Yes.
We have found all kinds of things in the belly button. I will personally clean it in your surgery. However, please, if you can remove bacteria, all kinds of lint, debris from your belly button before surgery, that will help keep it clean, minimize any chance of infection.
And your back as well. Make sure you scrub your back because you don't want to be on the operating table and they're cleaning you and they notice like they didn't clean their back.
Also, shave. Please remove all hair from areas around your surgery site 2 days before so you don't have any open cuts or wounds. So shave and start using the Hibiclens washes 2 days before surgery.
We don't want Dr. Kat to have to search through a national forest to find her incision site.
Yes, and we'll just end up, the nurses will end up shaving you on your operating room table, and it's just gonna, you're gonna pay for that extra OR time, so just don't do that. Shave before.
So 2 days before surgery, also please try to stick with a light diet. So even though you're not gonna be able to eat after midnight the day before your surgery, don't go like to the nearest In-N-Out and get a burger and fries.
Yeah, don't go to Disneyland and pig out because I actually had a patient who did that.
Yeah.
And when I did, because you don't want to be bloated during your surgery, some of the pain medication may also make you constipated, and you just don't want to be full of food and constipated after your surgery. You'll be miserable.
Trust me, it's not an issue that you want to have. You want to be able to focus on recovering and not be worried about your bowel movements.
Yeah, so eat light the day or two before surgery. Okay, so the night before surgery.
Oh, we're getting closer to your transformation.
Please do not eat or drink anything after midnight, and this includes drinking water. Now, you can take your medication if you have high blood pressure pills with a small sip of water the morning of surgery, but otherwise, please do not eat or drink anything the night before surgery.
That also includes mints, gum, anything that you put in your mouth. Please, just midnight, nothing.
Also, please do not put lotions, deodorants, creams, or anything like that on your skin. I'm going to be marking you just before we go into surgery, and so that will keep me from being able to mark you appropriately.
And also, you don't want to wear any valuable jewelry or contacts to the surgery center
we
the morning of surgery.
trust our nurses, but hey, if it's like something,
can't be responsible.
Not us.
You be responsible.
And also, just wear loose, comfortable clothing. I mean, please do not wear super tight leggings or pants, just something that you can get in and out of easily. So now we'll review the instructions specific for labiaplasty and labiaplasty with clitoral hood reduction.
Your favorite.
Yes, it is my favorite.
So when you wake up from labiaplasty surgery, you'll probably have little to no pain, which is amazing, but you will have swelling, so don't be alarmed about the swelling.
So the best thing for the swelling is to ice. And you want to also cover your incision with lots of antibiotic ointment. And it doesn't have to be a particular kind. It can be generic, any sort of antibiotic ointment that you can get from the pharmacy, and you're going to need tubes of it.
Lots and lots of tubes of it. You're going to be keeping the incision covered with ointment for 4 weeks.
And then also, for the first 2 weeks, icing really helps with the swelling. So the more icing, the better, but in general, we recommend 20 minutes on, 20 minutes off. Don't just leave an ice pack down there unmonitored. And you probably want to wrap it with something like a paper towel, just so you have some barrier. So if you imagine your labia, a thick coat of ointment, and then icing, and do that all the time when you're at home. So in terms of what to wear, you want to wear loose clothing.
Yes, nothing that is going to pull or squish the surgery site.
So no jeans, nothing with a thick seam, just wear loose clothing. And to protect your clothes from the ointment, we recommend that you get something like a disposable Depends, which is incontinence underwear, or a very thick maxi pad. Do not use a panty liner, because the panty liner is going to bend up and go in the crack and literally rub constantly on your surgery site.
Dr. Kat puts, 150 to 200 sutures in that surgery site. You don't want to disrupt any of them. You want them all to heal perfectly and dissolve on their own.
So make sure that you leave a gap between the pad and your labia, so that way as you're walking around, there's no friction on the labia. And no tampons, no sex for 4 weeks after surgery.
And no crossing your legs.
Oh, that's right. Do not cross your legs. I mean, it's common sense, but just you do not want to have your surgery site rubbing on itself or anything else.
So when it comes to showering after labiaplasty, you just want to be super careful not to disrupt any of the sutures.
So it's okay to take a normal shower and let the water run on it, but don't rub your surgery site. Don't rub it with a towel. Just gently pat dry. And if you want to feel more clean, you can just take a syringe, fill it with water, and just squirt the area, but nothing aggressive that's going to disrupt your sutures, because they're all dissolvable.
And remember, when you get out of the shower, lots of ointment on the surgery site.
Right, so it's pretty basic. Don't let anything touch it. Lots of ointment and ice. And when you're sleeping or resting, the best position is just to sleep with your legs bent up. Maybe use a pillow with the pad so you don't accidentally roll and crush your surgery site when you're sleeping.
And I know all girls just love to wear leggings. That's like the easiest thing to wear, but no tight clothing after labiaplasty.
So at around 3 weeks, you may see some of the sutures start to dissolve and fall off. That's totally normal. And around that time, people start to feel a little bit of itching from the healing.
Yeah, it's just your skin healing together. It's normal.
And the best thing to do is just ice and ointment. Do not put any weird creams, anti-itch creams, use any strange pads. I'm just trying to think of things that people have done.
Yeah, I mean, it is possible, since you're on antibiotics and it's a moist environment down there, that you may develop a yeast infection, but you can just see your regular gynecologist for any type of treatment for that.
Yeah, and usually it resolves just in a few days. But really, the post-op care for labiaplasty is very simple. Don't let anything touch it. Ice and use ointment. And then just relax and enjoy the process. Your anesthesia experience should be amazing. Like, you'll feel like you took the best nap of your life.
I know. I'm always jealous of the patients that they get to take like an 8-hour nap uninterrupted and then wake up looking amazing.
Think positive thoughts and support yourself with positive people.